New at 10, the life-saving monoclonal antibody treatment is now in short supply. It comes as state health leaders sound the alarm about a fifth wave of COVID-19. 3 on your side's Brendan Hall has details.
That's right, Maggie. A doctor I spoke with says it's not so much that there's a shortage of monoclonals, but more so that the supply that did exist doesn't work against this new Omicron variant.
Omicron has thrown a pretty horrendous curveball in the sense that our most commonly available monoclonals don't work against Omicron.
Monoclonal antibody treatment, which doctors say helped keep many people out of the hospital during the Delta surge, comes in more than one form. There's the Regeneron product, Eli Lilly's product, and sotrovimab, all of which are in limited supply, and sotrovimab is the only one that's effective against the Omicron variant.
We absolutely have had one of the really big weapons against this virus really taken from us.
Dr. Steve Threlkeld with Baptist Memorial Healthcare says this is problematic for those who could really benefit from the treatment.
There are people who are at higher risk of advanced disease and more severe disease, hospitalizations and death and the like, that we have to say, sorry, we don't really have anything to offer very easily right now.
UMMC says they're plagued with the same issue, providing WLBT with the following statement, quote, "We have a low supply of monoclonal antibody treatments, and when we get a new supply, including the treatment that works on COVID-19's Omicron variant, we expect to receive a limited amount." Dr. Threlkeld says there should be more sotrovimab around the second week of January. However, he says they didn't have a big market share to begin with, so even with ramped up production, supply will likely be limited.
It won't be the kind of thing that a healthy 55-year-old would get, even though it might have qualified. It probably will be limited to people who have more of a propensity toward having that severe disease.
Dr. Threlkeld says the vaccine is especially important given the shortage of supply with the monoclonals. He also says a new oral drug will come out in days that's proved effective in reducing severe illness. The only downside is that it doesn't interact well with other medications. In the studio, Brendan Hall, 3 on your side.